Good morning. Welcome to Juliette Kayyem. And I'll say a little bit about you. You were Massachusetts Governor Deval Patrick's Homeland Security Advisor and guiding regional planning and the state's first interoperability plan, if I can pronounce that, climate change policies, overseeing the National Guard. You were also President Obama's Assistant Secretary for Intergovernmental Affairs at the Department of Homeland Security, where you handled the H1N1 pandemic, the BP oil spill response. You organized major policy efforts in critical infrastructure protections. And before that, you served as the National Commission on Terrorism and a legal advisor to U.S. Attorney General Janet Reno. You're a trial attorney. You work for the Civil Rights Division of the Justice Department, and you're presently the CEO of Grip Mobility technology company looking to provide transparency in the rideshare industry. You lecture at Harvard Kennedy School, and there's a bunch of things I didn't mention.
That's fine. That's enough.
So, all right.
Hi, everyone.
Okay. So let's begin with, we know for certain that that certain groups in the United States, as well as beyond outside the United States, will be hit harder than others with the COVID-19 pandemic. People with less mobility, the elderly, people who are incarcerated, migrants in detention camps, people living in slums, low-wage workers, et cetera, who don't have access to healthcare.
Yeah.
So I wanted to ask, these are the vulnerabilities we live with normally. Are you seeing COVID-19 as a natural disaster, or is it really a human-made disaster?
Yeah, it's a good question. So I often say a disaster hits a country as it is, not as we want it to be. And so all of the things that we know exist, income inequality, racism, it's, the Asian, the Wuhan virus, the lack of mobility for certain populations, disability issues, they don't get cured by a pandemic or a crisis. They get exacerbated. And it's one of the challenges. Emergency management and disaster management has tried to address some of these particular concerns, in particular sort of disability rights, mobility issues. But we've never seen anything like this before. It's not only a 50-state disaster simultaneously. So, we've had crises that impact us all, like 9/11 or Katrina, but we've never had something in which all 50 states are activated, right, or actually working, let alone, close to 200 countries. We have to assume it's in every country. I think most of them aren't reporting. So what I would see is you're going to, the difference between, so it's a security issue, I think right now more than a public health one. I mean, in other words, you're going to see the tools of security, which tend to be coarse, over-inclusive, if your students understand that. I mean, in other words, they're not going to be intimate like how we tend to think about public health. They're going to be, how can we save the most people in the shortest amount of time? And that can be brutal, right? In fact, we're living that, right? We're social distancing because it's the only tool we have. Most of us aren't sick. Most of us aren't carriers, but it's over-inclusive because it's the only tool we have, brute force, to manage the curve. One hopes that on the other side of that, I think that there'll be more stimulus. I think the beginning of the economic help, I think that was just a dribble, what we saw, the 2 trillion. But I think that we'll start to see some of that more intimacy and focus on those populations in the months to come, once we get through what's essentially someone called this the hammer stage. You're just trying to do, and all of those other problems tend to be secondary at this stage.
So we're not fine tuning. We're just throwing money, throwing policy.
This period is called someone rightfully put it. I called it so I've used someone else's terminology. It's the hammer to the dance. So this is just trying to pound that curve down. And then on the other side of that, once we get capacity, and remember, there's going to be, I think the president speaks about it sort of misleadingly. There's where we are now, and then there's a vaccine. That's 18 to 24 months away. That doesn't mean we're inside that long. It means that period in between, say, if we're lucky, June, and what could be December 2021. I mean, you students are, this is your, world war in a way. I mean, the way that this is going to form these years in your life, we have no idea. I have kids your age. And that period is called sort of adaptation. We'll get out of our houses. There'll be treatments that if we get sick, we can take. There'll be better testing. There'll be temperature controls. We'll live differently. Big concerts, maybe that's a thing of the past. Movie theaters, maybe for a while. So stuff like that. So just think about, we're in the hammer to the dance. We're not at the dance yet, and the dance will help us with those communities that you mentioned at the beginning. I say this matter of factly, I'm not happy about it. I've just been through this enough.
Right. So for sledgehammering at a bar, big prom, and we're hoping to hit the nail here and there. Fine. It's a novel problem to an extent, but at the same time, experts have been saying for years, people in your field with your background have said it's not if, it's when. We live here with the CDC, which is an international organization based here in the United States, between work, internationally. We've run simulations. So are we being slammed with a surprise, or have we really been
What happened? So your students, so I was part of the H1N1 team, which was the last close to pandemic. We didn't really call it a pandemic, but it was definitely a public health threat. So each crisis is different, but crisis management is actually a skill that people have. There's 5 stages to a crisis. We think about planning. We think about supply chain distribution. We have our own terminology like emergency support, ESFs and ICS and NIMS and all these crazy acronyms, but they make sense to us. And it's a pretty professional group. So even things like the supply chain challenges that we're seeing today with the governors, like people like me sit back and go, honestly, that's the easy part. Logistics is easy. Just get stuff from point A to point B. It's not like, vaccine creation is hard, right? So my understanding from news reports is essentially the White House sort of either didn't abide by, you had a president who just was convinced that China could contain it. No other country but Great Britain. And the irony is great given what the sadness about the news, about Boris Johnson's sort of being in critical condition. Most countries knew that they would not be able to contain it, not a country like China, and started building testing facilities, started doing social distancing early. We've just been late on everything. Part of it was the president not recognizing or willing to admit what was coming our way, and then some of the challenges in operations and mobilization, like the failure to have a national stay-at-home plan. Most countries that have gotten over the curve, so remember China today, good news this morning, China had no COVID deaths yesterday. That is unbelievable, right? Because also we think they're lying about their numbers. There are numbers out there that will shock you that, some good experts think that close to 200,000 people may have died in China. But most countries that have gotten over the curve, and you're seeing Italy with some good numbers, have done so with unbelievably aggressive national social distancing. We're here in Massachusetts, we're being pretty aggressive, but that's not being followed around the states.
Are we being aggressive enough in the United States, and are we getting the leadership to have us do that?
So what I now say, I also, my other quote is, we fight a war with the president we have, not the president we want. That's just my politics. Apologize for, but I mean, we don't have, we have a 50-state crisis without a unified effort. So here's the good news, and this is what I've been writing in the Atlantic for. I've been doing a series of columns. Is in most crises, we and this is true always, you see a fail-safe system, what we call a fail-safe system, kick in. That is a system that exists to fill the gaps of system failures. So in this case, the system failure is the failure of the White House to take leadership of a strategic national plan. We still have 8 states with no stay at home. I mean, for your students and for us, that's hard to believe. Here we are entering week, 3 or 4? I can't even remember anymore, but like it's Tuesday. That I feel like that's progress, and I know it's Tuesday. So here we are, right? There are 8 states in the country that are literally normal. Like it's so hard to believe. So that's obviously, since viruses don't know borders, that's obviously not ideal, but it's not, as you know, it's not nothing. It's not nothing, because obviously New York City, Boston, we're seeing problems in Miami. We're seeing problems in Naples, and then of course Atlanta, New Orleans, and other stuff. And I think, I do homeland security. So I think, part of it is integrating state and locals. And I think when we look back, one of the things that we'll see is how little local and state leadership knew about what was coming. So one of the challenges, for example, Georgia has is, Louisiana has, because they're really bad. And, we're seeing the racial disparity in this as well, is they allowed Mardi Gras to go forward in February, which clearly was a mistake. I mean, in terms of what we're seeing. And, the mayor of Mayor of New Orleans, says, I had no idea. No one briefed her. Like, don't do this, right? Because in February, we were being told that, it could be contained.
So just 2 quick things. One is that, last week we read about historical lessons, and that recalls the 1918 pandemic, when Philadelphia went forward with a big parade and then saw massive, rise in cases. But that also brings to mind, we're a federal system, so states kind of operate somewhat independently. That could be both an asset and a liability in a pandemic where we need national coordination, but also a failure perhaps of leadership.
Yeah.
This is a global leadership class. So I want you to speak for a few minutes about what is required. I think leadership matters a lot in terms of setting a tone.
Yeah, I think it does.
Behavior. Not that whether you like the leader or not, it still matters who the leader is. So talk a little bit about what's needed in a pandemic or in a crisis.
Yeah. So, I think some of it is so systemic about how we treat public health in the world of national security and world affairs. We tend to talk about, war and diplomacy and intelligence and even law enforcement, right? But we tend not to talk about public health as being, a borderless threat that will impact us all. So part of it is just elevating those voices in the public health community that take on a leadership role. The WHO has tried to do that. They were, for all of their flaws, it wasn't like anyone following the WHO should have been surprised by this. By January, they are well aware that China's not going to be able to contain this. And then I think, I do believe still, despite everything that's wrong in the world, that the United States matters. And I think one of the things that we'll discover is, in the absence of U.S. leadership in this, the floor dropped. So I often say about security, the U.S. always sets the floor. If we take it seriously, everyone else takes it seriously. Like whether it's opiates or cybersecurity, we set the floor. And in this, we didn't. And I think that meant that the global leadership was lacking. We still matter. I know we have lots to complain about ourselves, but if we had taken that leadership role, I think that certainly other countries would have had cover, which is what a lot of leaders are looking for, right? Think about Latin America, South America. A lot of them want to say the US is doing this, Mexico, let alone the EU. So
just to clarify then for students, what you're saying is what the United States says and does, regardless of who our leader is, given historically who we are in the world, we matter. And so if the United States isn't setting a good example and setting the right tone, other countries can say, well, the United States didn't do it.
Not taking it seriously. Once China took it seriously, the news reports, have our internal apparatus here. There was a quote in the New York Times story saying, it was Richter level 8.0, right? That's the earthquake. That's a big earthquake. So we had the professionals in the US well aware of what was going on. They just, and knowing how seriously China took it. Now, I'm not defending China. China lied its way through December and early January. There's no question about it. But once it realized what it had, most people will tell you it changed its tune. Not perfect, probably still lying about some numbers. But so if you had China and the US both taking it incredibly seriously, we probably could have avoided social distancing in the way we're seeing it right now. And I should just add about social distancing. Most countries have national efforts. One of the things that I'm hopeful, don't get me wrong, I think enough things are coming on board to help us manage to live with the virus until the vaccine. But including new treatments, which are really the promising area right now. But the failure to take advantage of that time meant that the U.S., more than any other country in the world, this is not a good stat, has the highest number of distribution of positive cases across the largest geographic area. So Italy, you really could look to even though Italy's under universal national lockdown, it really was confined to northern Italy.
Okay. We only have a couple minutes left, so I'll invite students to put their blue hand up, and I'll try to manage it if I can.
I can do 5 more. It's my call, so just give me 1 second. I'll give you till 9:30 and then get off.
Okay.
Right then. Okay, great.
Okay.
I mean 9:40. Okay, great.
Yeah. Thank you. If any students want
You're
to
welcome. Yeah, I don't know what. Yeah.
Okay. And I'll try to get their question, but we'll chat a little bit.
I'll be faster too. I'm a long talker.
Okay. So one of the things that any president has at their disposal is the Defense Production Act. This is a post-World War II development that allows the president to kind of redirect industry, right, to, in this case, produce ventilators or whatever it is. President Trump has been using that Defense Production Act for many things, but not really to address, I don't think, our critical need. So what would you like to see the president do? First of all, what does the act authorize the president to do, and what would you like to see?
Right. So the president has a variety of tools available to him in a war setting, and one of them is the Defense Production Act. The Defense Production Act is a Korean War statute, but when people say that, people think, oh, it's old. It's not. It's been revised over the decades to take into account homeland security efforts, and so it's just really important that people understand. Like, we actually envisioned its use. It does a couple things. It allows us. Now, remember, none of this is what your students might understand as a taking. It's not a taking. The federal government sets fair market value and buys stuff, but we get to go to the front of the line and then distributes it to the 50 states. The president has, so you could either buy stuff already made at fair market value, so there's no price gouging, or you can compel manufacturing, which is what we're kind of starting to see, but barely. The president has been unwilling to utilize the DPA, and I do worry that it's too late. You just can't get manufacturing to pivot that fast.
Mm-hmm, mm-hmm. I want to just talk a little bit more internationally again and ask you sort of about this notion of collective security, which is embedded in the idea of public health, that we're not looking only at individuals' health, but the health of the public, whether one person's affected or not. And just thinking about that globally, we've been talking in this class about nationalism, the rise of nationalism, authoritarianism. Are we moving away from this notion of collective security that at least part of the world was dedicated to after World War II?
Yeah.
I think the pandemic is going to kind of bring us back around to that. Where are we at with that idea?
So I am taking a pass on what's the new world look like, because I think there's two totally opposing views. So one is we recognize our collective well-being, and the need for sharing and the need for transparency, and that leads to a whole new effort, right? The other is, my God, the only way we get through this is through authoritarian-like behaviors, which we're seeing. Like, for example, like, we don't talk about Latin America and South America. Most of those countries have deployed the military in ways they hadn't before. Mm-hmm. The U.S. is asserting authorities we never had before. Look at voting in Wisconsin. Like, people are using this threat as a way to undermine voting and democracy. So I don't know. I mean, I don't, what kind of new world order does this bring?
Okay. I wanted, you touched a little bit there on authoritarianism, and people have been talking about, say, Hungary, for example, which is already moving towards an authoritarian regime anyway. Is there some necessary trade-off in a pandemic for suspending some civil liberties? What must stay, what must go from maintaining democracy?
I mean, it's a great, so I think that the attributes of elections must stay. So I'm just very very concerned about what the Supreme Court did yesterday. If people don't know, they basically said Wisconsin had to go forward with its in-person voting because they denied an extension on mailing. There's pictures this morning, people standing 6 feet away from each other. Thank goodness for them. It impacts cities more than rural areas, so we'll have a partisan impact. I'm hoping that by the time in November, we will have enough of those tools. So that's your core functionality. Everything else, so long as it's done equally, is likely to be disrupted. In other words, my right to assembly is now not a right? In other words, under public health laws, Boston and Massachusetts are allowed to do certain things, but because they're impacting all of us equally, they're not picking me out because of my gender or because of my ethnicity. It's fair game, right? So what cracks me up that the gun lobbyists who are urging states to call gun stores essential to stay open, they're like, well, my Second Amendment rights, and I keep saying my First Amendment rights. Like, I don't get to see anyone. It's driving me nuts. But so I think all of it, so long as it's done, consistent with equal protection and some due process. I think this curtailing makes sense in terms of a common mission, in terms of the hammer.
Okay. Last question. This kind of gets a little bit on to First Amendment and freedom of expression. And that's about sort of the media and science. And similar to a previous question, I mean, there's a sort of move, at least part of the country, to eschew science, eschew, fact-based journalism. Is that part of the problem? Is that part of the man-made aspect of the pandemic?
Yeah, I think across the board, I think it's expertise. So whether it's supply chain logistics, which were pretty manageable before the White House got involved, to believing the science about what, lowering the curve or all of it has been sort of subject to debate. I think the biggest area you're seeing it now is the president's inclination towards quick fixes with this drug that he keeps promoting that hasn't, that other countries have said we're not using it. It's causing massive cardiac arrest. I think it's that idea of, well, science is a quick fix. It's not. It's really hard, and it's hard to get a vaccine. And then we're not even talking, once you get the vaccine, we're not even talking about manufacturing and distribution. That's a huge ethical issue, huge operational issue. So it's a challenge. But I'm going to leave on a positive note. A fail-safe system is also working. Governors, mayors, us, we're part of that. The private sector, NGOs are filling the vacuum. So I think that we'll see horrible numbers, but they won't be as bad as if I told you, the president is not having a national effort.
Mm-hmm. Okay. All right. I know you have to go, and I
have to go, you guys. Nice to see you. Thank you.
Thank you for your service and for your time.
Oh, thank you. Yes. Well, thank you for putting up with me, but I did get a workout this morning, so it was a good morning.
All right. You're a step ahead of me. Thanks so much.
Take care. Talk to you later. Bye.
Okay, bye-bye.
Bye.